Hi, so today Ashby and I are going to be talking about the Achilles tendon rupture and kind of what that looks like and what happens when you do rupture that. So, the Achilles tendon is a tendinous tissue within the posterior or back aspect of the lower leg. This starts as a combination of both heads of the gastrocnemius and the soleus muscles or the calf, where they join together, and is going to end as an attachment on the calcaneal tuberosity or the calcaneus or heel of the foot. And this is going to play a very large role in plantar flexion of the foot during walking, running, jumping. So basically, a rupture of the Achilles tendon is when the tendon fully tears. This is generally going to happen after a fast or powerful muscle contraction of the subsequent calf. And this can happen with acceleration or deceleration movements as well as any sports that do a lot of jumping movements. The types of tears of an Achilles tendon include type 1 tear, which is just a tear in the tendon, type 2, which is where the full rupture comes in, and so this is a full rip or rupture of the tendon with less than 3 centimeters of movement for a type 2. Type 3 is going to be 3 to 6 centimeters of movement, and then type 4 is going to be greater than 6 centimeters. This tendon could also tear from the insertion point of the calcaneal tuberosity, resulting in an avulsion fracture.
So next we'll talk about kind of who's primarily affected. You'll see younger and older adults get affected, but for the younger it would be in your 30s, and those are the people that are prone to Achilles ruptures while playing sports, and it's mainly your men more than your women. When you get into your older population, either like 60 and up, they're just prone to rupture during just normal activity, and that's where you see more women tearing their Achilles tendon. You will see most athletes affected when they're starting an activity that they're not normally used to, like running or jumping, that they just aren't prone to do. Some signs and symptoms that one should look for is if the individual is unable to bear any weight on it, they can't plantar flex at the ankle. If they were doing some activity and they hear pop, that's a good telltale sign. And then if there's any redness and swelling that is noticed in the near the calcaneus. Some evaluations that are best to do is the Thompson test, where the athletic trainer will squeeze the gastrocnemius and see if the ankle will plantar flex. And so if you squeeze it and the foot plantar flexes, then you know that your Achilles tendon is intact, everything's pretty good. But if not, then you know there's a problem. You also go through some passive range of motions, and if you feel there's a gap in the muscle, then you kind of know that something's wrong and there could be an Achilles tendon rupture. In order to treat it, you can have either surgical or non-surgical options. Your non-surgical options, you'll put the individual in a cast with their foot pointing downward, just to immobilize the foot and allow for healing and repair of that Achilles tendon. And then once you get the cast off, you'll follow that with some rehab. And then your surgical methods are meant for those who are trying to be active and return to play after after the injury. And you'll go in for surgery. The physician will repair the tendon by suturing it together. And then following the surgery, the foot will be put into a splint or some kind of walking boot so that it can heal. And then after that, once you get your splint off, you will do some rehab for 4 to 6 months. Then here are the references.